Jugular venous pressure, or JVP, is a measurement of the elevation at which the highest oscillation point, or meniscus, of the jugular venous pulsations is usually evident. The measurement reflects pressure in the right atrium, that is, central venous pressure. Estimating the patient's JVP is one of the most important and frequently used skills of physical examination, and often the first step in your cardiovascular assessment. In the beginning, estimating the JVP will seem difficult, but with time, you will find that the JVP provides valuable information about the patient's volume status and cardiac function. The JVP is best assessed from pulsations in the right internal jugular vein.
You can lie back for me.
Raise the head of the examining table to 30 degrees, and with the patient supine, place the patient's head on a pillow to relax the sternomastoid muscles. Then adjust the patient's gown and drape.
There you go. Very good.
Using tangential lighting if necessary, examine both sides of the neck. Then turn the patient's head slightly to the left, since the physical examination is conducted from the patient's right side. Focusing on the right side, identify the external jugular vein. Then find the internal jugular venous pulsations. If necessary, raise or lower the head of the bed until you can see the oscillation point of the internal jugular venous pulsations in the lower half of the neck. Look for the oscillation point along the sternomastoid muscle, between the clavicle and the angle of the jaw, or just posterior to the sternomastoid. Internal jugular pulsations have a soft, rapid, undulating quality, usually with 3 elevations per heartbeat, 2 of which are visible, and 2 troughs, whereas the carotid pulse provides a more vigorous thrust with a single outward component. Internal jugular pulsations are rarely palpable, whereas the carotid pulse is almost always palpable. Internal jugular pulsations are eliminated by light pressure on the vein just above the sternal end of the clavicle. The carotid pulse is not eliminated by the pressure. The level of internal jugular pulsations changes with position. In a euvolemic patient, the level in the neck drops as the patient becomes more upright, whereas the carotid pulse is unchanged by position. Finally, the level of internal jugular pulsations usually descends with inspiration, whereas the carotid pulse is not affected by inspiration. Measure the oscillation point of pulsation in the right internal jugular vein using the following technique. Extend an elongated rectangular object, such as a 3x5 card, from the meniscus point of pulsation, while extending a centimeter ruler vertically from the sternal angle, making a right angle. Establishing the true vertical and horizontal lines to measure the JVP may be difficult. As you place your ruler on the sternal angle, line it up with something in the room that you know to be vertical. Then place your card or other rectangular object at an exact right angle to the ruler. This constitutes your horizontal line. Now place the card at the point of oscillation of the jugular venous pulsations, making sure to keep the card horizontal. Then read the vertical distance where the card crosses the ruler. This measurement identifies the jugular venous pressure, or JVP, the vertical distance in centimeters above the sternal angle where your card crosses the ruler. Round your measurement off to the nearest centimeter. In this patient, the JVP is about 1 centimeter above the sternal angle, with the head of the bed elevated 30 degrees. Venous pressure is elevated above normal when it measures at greater than 3 to 4 centimeters above the sternal angle, or more than 7 to 8 centimeters in total distance above the right atrium with the bed elevated to 30 degrees. The steps for measuring the JVP, when followed carefully, result in a measurement that is important for assessing the intravascular volume status in euvolemic, hypervolemic or hypovolemic patients.